Hey guys, let me make sure we're streaming and we're live. Good speed. We'll just start in 2 minutes, guys. Welcome to Unacademy. Let's crack NEET PG. So today's class is another MCQ marathon that we are doing after a long time, right? So we used to do these MCQ marathons every day. A lot of you have told me that they've been very useful for you. So here we're back with one for the thorax. That's one of the topics left along with the abdomen. A lot of you have told me that they've been very useful for you. So here we're back with one. So if you can hear me, just say hello so that I know that you are live and you're listening. And then we can move on to starting with the class. So guys, you can skip ahead through the first 5 or 7 minutes. That is going to be the subscription pitch where I will be telling you about Unacademy. So since we are live right now, you guys can watch these 5-7 minutes. After that, it will be a live consecutive MCQ marathon. Today we are going to cover at least 50 questions. That's the target. Okay, hello Sukanya. Today's target is 50 MCQs of the thorax, right? Thorax is a relatively easy topic. So we will be covering 140 MCQs or let's say 150 MCQs of the thorax. Not sure, 140 to 150 MCQs of the thorax we'll be doing. And these MCQs, they will be more than sufficient. They will be more than sufficient to revise all the concepts that are there in thorax, right? Okay, so don't think of this as only a testing class. Think of it also as a learning class. Think of it as you will be learning more about the thorax through this class, right? So as I said, welcome to Let's Crack NEET PG, the YouTube channel of Unacademy's NEET PG division, where you have top educators, you have quality content from all of us, and you are assured a great learning experience, right? So you guys can introduce yourself also. The best thing about the YouTube live chat is that you can be very anonymous. Nobody will know who you are, so you can speak freely. If you don't understand something, just stop me right there and I will explain it again to you. My name is Chetanya Mittal. I'm a third semester MBBS student at All India Institute of Medical Sciences, that is AIMS, New Delhi. I'm at my hostel right now, and All India rank 4 in the AIMS UG entrance examination, All India rank 5 in the JIPMER UG entrance examination, right? And now, as you know, all of these examinations have been merged into a single entrance called as the NEET examination. For PG entrances, you know that soon there is going to be the next examination, which is going to be from a clinical perspective, where you will have 10% weightage of pre and paraclinical subjects. And this year there is an exam called INICET for all central institutes, including AIMS, PGI, JIPMER, etc. Alright. So today's topic is MCQ marathon for thorax part 1. So we're probably going to be doing 3 parts. Today is part 1 of this series. Right? So let's start. First of all, I have to tell you a little bit about Unacademy. As you all know that Unacademy is India's largest online learning platform. So all of these classes, they are going to you through YouTube, right? Because these are Unacademy's classes for the mass audience, right? But the idea is that you download the Unacademy learning app so that you can take advantage of more such content, right? So you just go ahead to the Play Store and just click on install, and you will be able to install the Unacademy learning app. Once you have done that, you will be able to access content from all the top educators who are making plus courses, right? So you can see that we all have a decent number of watch minutes and a decent number of followers who are actually following us, and we are all making plus courses for you. All right, all the top educators, they make plus courses for complete stuff, right? Like for example, for pediatrics, there is a course on genetic and metabolic errors in pediatrics, right? Which you can go ahead and watch also if you are preparing for your NEET PG. I am also making a plus course which is launching on 22nd November. On 22nd November for gastrointestinal physiology, right? Where I will cover gastrointestinal physiology in detail along with some explanations, along with some MCQs. ठीक है, बिल्कुल परफेक्ट कोर्स है gastrointestinal physiology के लिए. इस तरीके से every educator makes some courses. All right. Now coming to why you should download the app even if you don't take the subscription. There are special classes on Unacademy's platform. Okay, what are these? They are basically given free of cost by educators. Okay, they make these free of cost. And for example, if you want to know what were the questions that were there in let's say general surgery in May 2020 AIMS, right? So you can go ahead and watch this video which gives you the entire content that was there during that particular examination. Or if you want to discuss the embryology of the heart, right? I have made lots of special classes in the last 3 or 4 days. I discussed coronary circulation from thorax in detail. ठीक है, तो coronary circulation बहुत important topic है. उस पे I have made a free special class, so you can go ahead and watch this special class. Okay. How many of you have already downloaded Unacademy learning app? Please tell me. The people who are live, out of you, please tell me how many of you have already downloaded the Unacademy learning app. Because if you have, then we can also do a live quiz through that. Okay? I'll create a quiz on the spot and then you guys can attempt that at the end of today's class. Okay? Because the advantage here in Unacademy is that they have an unlimited question bank. ठीक है, बहुत सारे questions हैं उसमें, and you have some mock tests which are free. But if you take a plus subscription, you have access to unlimited mock tests. Yeah, right? You have access to unlimited mock tests from Unacademy's side. ठीक है, and you have comprehensive syllabus courses in 3 parts: pre-clinical, part B is paraclinical, and part C is clinical. Right? So नेक्स्ट के पॉइंट ऑफ व्यू से पार्ट सी में सबसे ज्यादा वेटेज है. देखो 33 कोर्सेज आर देयर फॉर पार्ट सी बिकॉज क्लिनिकल हैज मोर वेटेज, राइट? सो दैट्स अबाउट दिस. एंड नाउ you all should know that why you should be learning online. Simple thing, MBBS students, busy life schedule, तो फ्लेक्सिबिलिटी बहुत इंपॉर्टेंट है. कभी डिनर करना है बंदी के साथ, कभी कुछ और काम है किसी के साथ, ठीक है, कभी पढ़ाई करनी है, किसी टाइम कोई पेपर आ रहा है. तो फ्लेक्सिबिलिटी इन द शेड्यूल, रिकॉर्डेड लेक्चर्स, ऑल ऑफ दिस इज वेरी इंपॉर्टेंट फॉर यू. ऑलराइट. एंड लर्निंग इन द लैंग्वेज ऑफ वॉट एवर चॉइस यू हैव, इंग्लिश, हिंदी, मलयालम, तमिल. देयर आर एजुकेटर्स, आप मानोगे नहीं, नीट पीजी के लिए रीजनल लैंग्वेज में पढ़ाते हैं, राइट? एंड यू हैव द ऑप्शन फॉर अनलिमिटेड प्रैक्टिस वेयर यू कैन keep on taking quizzes again, you can watch recorded sessions. Okay, so you can learn anytime, anywhere you want. All right, so access is universal, there is no limitation. You can chat with the educator, right? Platform पे तो बहुत अच्छा chat option है where you have the option of conducting polls also. Here also on YouTube I try to do it in the most interactive way. All right, I welcome your comments in the chat box, ठीक है, because live chat चल रही है. I have opened it on my phone. I can read it simultaneously. All right, कभी कभी थोड़ा lag आता है, but otherwise it's mostly simultaneous. I'll be asking all the answers from you. All the questions that we do today, I will be asking the answers from you. Now all you have to know is the pricing of Unacademy's platform. So there is Unacademy Plus and there is Unacademy Iconic. The good thing about Unacademy Plus is that Unacademy Plus is having live classes, live tests and quizzes. Then there are batch courses which are taken by multiple educators together and you get a structured schedule for your preparation. These are all the advantages of Unacademy Plus. Yeah, but there is one thing that is Unacademy Iconic. That is even beyond Unacademy Plus, because as you know that Unacademy, India's largest online learning platform, has acquired Prep Ladder. जो मेडिकल के लिए टॉप प्रिपरेशन टूल है। क्यों कि यहाँ पे जो फैकल्टीज पढ़ाते हैं they have had so much experience and they are so polished, like GRG sir who teaches pharmacology, अपूर्व मेहरा सर who teaches ortho, right? And ये prep ladder तो kind of लेना ही पड़ता है PG preparation के लिए। So I would recommend that you take Unacademy Iconic, at least give it a 6 month trial or a 1 year trial. And here you get all the video lectures, all the question banks, rapid revision course and handwritten notes from prep ladder itself. ठीक है? So you will get access to everything. NEET PG subscription for Iconic includes, so you have to, minimum base plan is for 1 year. Okay, so if you are in the final year, you can take this. It will cost you 55,000 rupees, but if you use my referral code, see, my referral code is Chetanya10. Just apply this referral code and you will get a 10% off straight away. Besides that, you can apply credits. Okay, if you have any doubts or if you need any help regarding the subscription, you can contact me at the rate chetanya.blue. That is my Instagram ID, and you can contact me on Telegram. My Telegram channel is at the rate NEET PG Chetanya. That's my Telegram channel. Just search for this in Telegram. You will find my Telegram channel. You can join it, and there is a discussion group there. You can interact with me, right? You can also type messages. So that is the 10% off you get for every course. So if you are in the second year, you can consider taking the 3 year plan. ठीक है, लंबा bulk subscription जब भी लोगे, it will always be cheaper to you. This will cost you 82,800 with my referral code. All right. And if you need any help with the monthly payments option, because you have a no cost EMI that is there on all plans that are beyond 6 months, there is a no cost EMI. You don't have to pay anything extra for that EMI. Okay. And these are all the plus courses. Plus by itself is a little expensive because there are multiple educators, multiple experienced educators teaching you. So here also you can see 3 year plan hai, 2 year plan hai. यहाँ पे you also have shorter plans, so you can try it out for 6 months or 3 months, whatever suits you, right? If you're appearing this year only, you can try out the 1 month plan only. Okay. So this is where you have to enter the referral code. Okay. Remember one thing, do it on Android only. All right. If you don't have a Android phone, take one from your friend. All right. And then take the subscription or take it on the desktop, because if you try to take it on iOS, what it does is it does not give you extra discount. It gives you extra weeks. ठीक है, तो बेटर ये है सीधा डायरेक्ट कैश डिस्काउंट लो रेफरल कोड से, चतन्या 10 रेफरल कोड डाल के अप्लाई करो, क्रेडिट्स अप्लाई करो. And remember, this referral code is not valid only just for NEET PG. This is valid for all courses. If your brother or sister is taking a NEET UG or a IIT course or UPSC course, you can use it for them also, right? Okay, clear? So this is everything regarding the subscription. Comparison of the Iconic and Unacademy Plus pricing also is there. So I will move on to question number 1. Should we start? First of all, guys, I want you to all type at least one message so that I know your names and I can interact with you very effectively. So the video is actually starting here. Guys, hello. Can you write that you are ready for the quiz? Kanya, are you there? Today you will see that I have prepared a very quality presentation, because see, today what I have done is I have given an image for almost every question where an image is possible, because I know that I have not taught the entire thorax in a flow. So you might have some confusion somewhere. So I have put an image for every question so that there is no confusion at all and you are able to grasp each and everything very carefully. Okay. So the Chinese also here. You were there in yesterday's class also, right? So two people are there who I know. Let's start. Question number 1. Give the answer in the chat box. Branches of the left coronary artery. Read the question very carefully, then answer. Okay. So Sukanya has answered as option A. To inform you, Sukanya, okay, I'm waiting for Dhaj Chaini to answer because yesterday Dhaj Chaini was answering very well. Dhaj Chaini, are you a guy or a girl? Because I don't want to use a wrong pronoun here. But yeah, I'm waiting for your answer or anyone else who's online because I can see there are 5 to 7 people right now who are online. Okay, the Chinese are good, right? So the Chinese is also given a wrong answer. Okay, so both of your answers are wrong, guys. Sukanya and the Chinese. Anterior interventricular branch is also wrong. Left atrial artery is also wrong. The correct answer is option C. Posterior interventricular artery. All right, posterior interventricular artery. It is also called as the right descending artery. It is also called as the right descending artery. The correct answer has been given by Vasudha Nandini. All right. So welcome Vasudha. So right descending artery is the correct answer. Okay. So how do you guys do this? First of all, if you haven't watched my lecture on coronary circulation, it is there on Unacademy. Go ahead, go to my profile. My Unacademy profile is @Chetanya Mittal 354586. Okay. If you're searching on web, just write unacademy.com @this. Okay, you will be able to find my profile. Okay. Otherwise, you can directly search for me on Unacademy. You will be able to find my profile. And I have made a class on coronary circulation. Please do go ahead and watch it. I've kept my notes here. Okay, because from that class I had some beautiful notes. I had made a short note summary for all of you. So here, देखो, I have shown you what are all the branches. So the left coronary artery divides into the anterior interventricular artery and the left circumflex artery. It gives an atrial branch, right? It gives an atrial branch, and then it also gives the anterior interventricular branch. Obviously, it gives the circumflex branch, and the diagonal artery is also a branch of the left coronary artery, right? So all of these are branches that are coming from the left coronary artery. The posterior interventricular artery, as you know, in 90% of the people, it is a branch of the right coronary artery, and in 10% of the people it is a branch of the left circumflex artery, which is a branch of the left coronary artery. So we will consider this 90% of these cases because maximum have right cardiac dominance. So the answer is option C, that is posterior interventricular branch is the most appropriate answer because it comes from the right coronary artery in 90% of the cases according to right cardiac dominance. Question number 2. Let's move on to question number 2. Okay, just have a look at this. This is everything that you need to know about the left coronary artery. Given its distribution, I've given its course and branches, and I've given its entire supply. Okay. Question number 2. What is the commonest location of diaphragmatic hernia? Commonest location of diaphragmatic hernia. Commonest location of Boscherdelic hernia. Okay, I know that you might not be able to answer this. This is a typical NEET PG question, right? This is a very typical NEET PG question. So even if you are not able to answer this, just give a guess and then we can quickly move on to the next question. Just give me a guess quickly, guys. Okay, so Kanya has guessed B, posterior and left. That's actually the right answer. That's actually the right answer. See, there are two types of congenital hernias. There are two types of congenital hernias in the diaphragm, right? Two types of congenital diaphragmatic hernias, right? What are those? One is the Boschedelic hernia, one is the Boschedelic hernia, the other is the Morgagni, right? It is the Morgagni, right? Chetanya is also right. Vasudha is also right. All of you are right, surprisingly. It is a difficult question. Morgagni is the retrosternal hernia. It is the retrosternal hernia, so it's basically behind the xiphoid process. And Boschedelic hernia, you can see where it occurs. So look here. This is the xiphoid process, right? This is the xiphoid process of the sternum. And behind that, this is the retrosternal site for a called as foramen of Morgagni. This is called as foramen of Morgagni. And if there is herniation from here, that is known as a hernia that occurs through the foramen of Morgagni is called as a hernia, diaphragmatic hernia of Morgagni, right? There is also a foramen of Boschedelic. There is a foramen of Boschedelic, right? It can be on the left side, it can be on the right side, and it is present posteriorly. So right-sided herniation is only in the 10 to 15% of the cases. हाँ यार बता urgent है यार मैं क्लास ले रहा हूँ किसी और से मांग basically what happens is the left-sided herniation, it is in 80 to 85% of the cases. So this is called as, this is the more common one. So it is on the posterior and the left side, right? Very good. Next question number 3. Today at the end of today's class, I will be generating a quiz code. I will be generating a quiz code and we'll start a quiz on Unacademy's learning app that you can join there. At the end of today's class. Question number 3, what's your answer, guys? See, you can write your answers in a format that makes it easy for me to know that for what question you have written your answer. Write question number 3, then write a dot, and then write your answer. Like the Chenny and Vasudha have answered this question already, and they've given the answer as option B. Okay, that's right. Structures passing through the central tendon of the diaphragm, right? So you should know completely what passes from where through the diaphragm. That's very, very important. Be it for your prof examinations, be it for your uh, NEET PG entrance. So all of you have been able to answer correctly. The answer is right phrenic nerve. As you can make out, the vena cava opening is in the central tendon. The vena cava opening, it is in the central tendon, and along with it passes the right phrenic nerve, which we can make out is in the central tendon, right? The left phrenic nerve, it passes through the left crus of the diaphragm. It passes through the left crus of the diaphragm. So that's about this. Okay. So if you look here, this is the aortic opening that you can see posteriorly, and this is the esophageal opening, right? All of them are at different levels, T8, T10, T12. Okay. So let's move on. Let's move ahead. Question number 4. Which of the following does not drain into the azygous vein? This is a very, very important ultra BTR question. What is BTR? BTR means buri tarah rato. Okay. That's a terminology we have here in AIMS. There is no case in which you should forget this. The azygous, the whole azygous venous system, where you have the azygous vein, the hemiazygous vein, and the accessory hemiazygous vein. Very thorough with it. A very good image though, where you will be able to easily understand where does the left, superior intercostal, right superior intercostal, posterior intercostal, hemiazygous drain. Waiting for your answer. So write your answer as 4 dot whatever your answer is. Much of the following does not drain into the azygos. Your answer is option C, left superior intercostal vein. That's absolutely correct. Right? So Kanya has been able to answer fastest and correctly. The Cheney has unfortunately answered a little incorrect. Alright, she was right in thinking superior intercostal vein, but it's the left superior intercostal vein. Now, how do you remember that? Right? How do you remember that? Just think of it in this way. That's very superiorly if you think. On the right side is your superior vena cava, right? On the right side, your superior vena cava is there, and the azygos is very close towards the right side. Okay? So towards the right, everything can drain properly, but towards the left, even before the left superior intercostal can reach the uh, hemiazygos, right? Before it can reach any of the veins here on this side, before that, it can directly drain. It has the option to directly drain into the brachiocephalic trunk. It has the option to drain directly into the left brachiocephalic trunk, right? Because on the left side, the brachiocephalic trunk is closer, and on the right side, for the right superior intercostal, what is closer? For the right superior intercostal, the closer vein here is going to be not the right brachiocephalic trunk, but it can drain normally, right? So here you can see the left superior intercostal, it is draining here. So that is why the left superior intercostal, it does not drain into the azygous vein. Otherwise, everything mostly it will drain through the azygous vein only. Okay. Question number 5. It's a very good question. Bronchopulmonary segment. So there are three very important questions. Sorry, four very important questions from your thorax part. One is going to be mediastinal relations of the lung. And the root of lung. So kind of two topics are very similar. And from lungs, you also have to study bronchopulmonary segments, right? Bronchopulmonary segment. Two topics are these. And third topic is conducting system of the heart, which you probably already know from your 11th and 12th. So you can also skip it, but you should be aware of it. And D is coronary vasculature. This is very important. Yeah, and I have also made a video on the YouTube channel for this, for Let's Crack NEET PG. You can also refer to this. Very good simplification. Question number 5, you guys have answered. Bronchopulmonary segment contains all except. The except that you have chosen is an independent pulmonary vein, right? That's true. That's the correct answer. That's Cheney. You've correctly chosen the right answer. So have a look here. Bronchopulmonary segment, they're basically well-defined sections of the lung, and there are 10 in each, in both the right and the left lung. Remember, there are 3 lobes in the right lung, and there are 2 lobes in the left lung, but the number of bronchopulmonary segments is equal. There are 10 in the right and 10 in the left. Alright? And all of them are pyramidal and they have their apex directed towards the hilum. They contain segmental branches. They contain a pulmonary artery each and they contain a bronchial artery each. Alright? They each contain a pulmonary artery and a bronchial artery. But the pulmonary vein, it is intersegmental. The pulmonary vein, it is intersegmental, that it is passes between the bronchopulmonary segments. And each bronchopulmonary segment does not have its own pulmonary vein. In fact, the pulmonary veins are shared, right? So bronchopulmonary unit is independent, right? Bronchopulmonary unit is independent, but there is no individual bronchovascular unit, because even though it has its own artery, even though it has its own independent pulmonary artery, but it does not has its own independent pulmonary vein. So it is not an independent bronchovascular unit. It is only an independent bronchopulmonary unit, right? That is why it is called as bronchopulmonary segment. Otherwise, we could have called it bronchopulmonary vascular segment. But pulmonary vein is shared. This is a very important thing. So you can see here independent pulmonary artery, that's true. Tertiary bronchioles, yes, tertiary bronchiole is where you call it bronchopulmonary segment. And conical segment is basically, I just told you, it is pyramidal in shape, right? It is pyramidal in shape, so it's kind of like a cone with its apex pointing towards the hilum. All right. Question number 6. Afreen Alam is also here. Afreen Alam is answering question number 6 as C, as azygous vein. Vasudha has also answered. Sukanya has also answered. Very good. Okay, right. Very good. The answer is option C. Now, can anybody tell me why is it the azygous vein? When the great vessels and their branches. So look here. Look here. The great vessels and their branches, they are included in the superior mediastinum, right? So it means that the superior vena cava, it is one of the great vessels. It is included in the superior mediastinum, right? But the azygous, which drains into the superior mediastinum, it is not included. It drains into the superior vena cava. Why it is still not included in the superior mediastinum, right? We are including the trachea, we are including the thymus. Thymus is present in front of the trachea. Okay, that will be there. Trachea will be there. Great vessels and even their branches are there. So why is not azygous vein there in the superior mediastinum? Can you tell me why? Answer is very simple. You should just know what is the superior mediastinum, and then you have to use one of my videos. So right, I told you in one of my videos that importance of sternal angle, if you remember. Yeah, there is a video of mine about the sternal angle and its mnemonic also, because those 10 points, they are a direct question. What are the events that occur at the sternal angle? So sternal angle, one very important thing happens. Azygous vein, it drains into the SVC. Azygous vein, it goes ahead and drains into the SVC, and that occurs at the sternal angle, which is the T4 to T5 vertebral level. All right, at the intervertebral disc between the T4 and T5. Superior mediastinum, it starts from the manubriosternal junction. It starts from the manubriosternal junction where you have the inlet of the thorax, and it goes up till T4, right? So superior mediastinum is still here. So obviously, azygous vein is, by that time it has already drained into the SVC, so therefore it is not contained in the superior mediastinum. Rest all of these, they are structures of the superior mediastinum, no doubt about it. And if you talk about the posterior mediastinum, the azygous vein, it is a content of the posterior mediastinum, because initially it is going along with the thoracic duct and the aorta and everything, right? So these are the contents of the posterior mediastinum that I've shown. They're basically the behind the pericardium, right? So that's the posterior mediastinum, right? Question number 7. Okay, question number 7. Let's move on to question number 7. Right, so we've just discussed this, that the azygous vein, I've just told you that the azygous vein, it drains into the superior vena cava, right? And we know that at what level does this happen? This happens at the level of the sternal angle. This happens at the level of the sternal angle. That is at the level of second costal cartilage or T4, T5 vertebral level. Alright? So that is what you have to pick. 7, the answer is C. Okay? So you can make out here the azygous vein. It is draining into the superior vena cava. We will see this figure a lot of times today because this is a very important concept, everything here. Question number 8. Okay. 7, everybody is able to answer. Dhatchani, Sukanya, Vasudha, Afreen, very good. Superior epigastric artery, it is a branch of which artery? Superior epigastric artery, it is a branch of. Very good. Right. So the answer is option C, internal thoracic artery. Internal thoracic artery. You should be very clear with that. Why? Because the branches of internal thoracic artery, they are first of all very important. Okay. There are direct question that can come. This is the internal thoracic artery coming, as you can make out from above. This is the internal thoracic artery coming, which is crossed by the phrenic nerve. Divides here. It gives a pericardiophonic branch, and its terminal branches. What are its terminal branches? So at the end of its course, what the internal thoracic artery does is it divides into two. One is the superior epigastric artery, and the other is the musculophrenic artery. Right? The other is the musculophrenic artery. So the two terminal branches. So if this is the internal thoracic artery, right? It will divide. It will terminate by dividing into musculophrenic artery and superior epigastric artery, which you know that inside the rectus sheath, they will anastomose with the inferior epigastric artery. Inside the rectus sheath, it will anastomose with the inferior epigastric artery, right? So the superior epigastric artery is a branch of the internal thoracic artery. Now, what are the branches of internal thoracic artery? There is a mnemonic for that. If you guys want to remember it, you guys know what is the mnemonic for branches of internal thoracic artery? Okay, so the mnemonic goes something like this, that one of the branches is pericardiophonic. One of the branches is pericardiophonic. I just showed you the pericardiophonic branch, right? Besides pericardiophonic, it gives anterior intercostal arteries. All the anterior intercostal arteries, they are coming from the internal thoracic artery. Now, what is the artery we just talked about? Musculophrenic artery. Okay. Then it has a few. Then it has a few. Okay, wait, I'll tell you. First the terminal branches. Terminal, and in between I remember perforating branches. Okay, P for perforating branches. Okay, so it has already given pericardiophrenik branches. It gives pericardial branches here. Then it gives anterior intercostal artery, musculophrenic artery, perforating branches, and then it gives the sternal branches. Sorry, superior epigastric artery, right? It also gives sternal and mediastinal branches, but right now we are not going into that. So the mnemonic that you have to remember is PAMS. Okay, you will see PAMS is also pattern associated molecular patterns, right? PAMP is also pattern associated molecular pattern, but PAMS is the mnemonic that you can go for to remember branches of the internal thoracic artery. Question number 9. Question number 9. Okay, I forgot to ask you one thing. Inferior epigastric artery, it is a branch of. Inferior epigastric artery is a branch of. I told you it anastomosis with inferior epigastric artery, the superior epigastric artery, it anastomosis with the inferior epigastric artery, right? But what is the inferior epigastric artery a branch of? So you answered for question number 9. Let's first talk about this question. Tell me, inferior epigastric artery, it is a branch of. 9 is C. You all are right. Posterior interventricular artery, it is a branch of the artery, the right coronary artery. This is again the concept of coronary dominance. In 90% of the population, it is a branch of the right coronary artery. In 10% of the population, it is a branch of the left circumflex artery. Alright, that's true. Now, you all have written for my previous question, you all have written the correct answer that the inferior epigastric artery, it is a branch of the external iliac artery. It is a branch of the external iliac artery. Absolutely correct. Okay. So it is very important, this anastomosis, superior epigastric artery and inferior epigastric artery. You will realize that it forms a very important collaterals whenever there is some kind of an obstruction. It is very important for collaterals to form. Alright, the anastomosis between the superior epigastric artery and the inferior epigastric artery. Okay. Now, okay, I've already told you that posterior interventricular artery, it is a branch of the right coronary artery in most of the cases. Now, question number 10 is a sensible question. Question number 10 is an important question. Guys, what's your answer? ओके, हिस्ट्री 10th का आंसर दे रही है ई तो ऑप्शन में ही नहीं है। ई तो ऑप्शन में ही नहीं है भैया। Okay, the answer that Misty was trying to give was D, which has also been given by Sukanya. Very good. That's correct. These three do form boundaries of the triangle of Koch, but the origin of the left coronary artery, it is not one of the boundaries. So you can make out here that this is the coronary sinus, this is the orifice of the coronary sinus. So it is one of the boundaries. Then you have the tendon of Todaro, right, which is a ridge basically here. And the third is the septal leaflet of the tricuspid valve. Again, going to be a boundary of the triangle of Koch. And tendon of Todaro is one of the boundaries. That is what you can remember. The AV node is also located in the triangle of Koch. It is located at the apex of the triangle of Koch. AV node is located in the triangle of. That is one thing that you can probably remember from here. Okay. If you know about the blood supply of the AV node, that is also the blood supply of the triangle of Koch. Okay, that's one thing. Okay, next. Question number 11. I hope you are able to make this out. Question number 11. Most dependent part of the lung. Fine position. That's correct. The answer is going to be lower apical. The answer is going to be lower apical. See, there is this thing where you have to know that lower apical and posterior basal, they are both going to be dependent part of the lungs in supine position. Alright. So if I have to show you a diagram for this, I will show you this diagram. Look at this. This is going to be the lower part of the apical, lower apical. So this is going to be your apical lobe. This is your upper apical, and this is your lower apical, right? This is your posterior basal. Again, here also you can make out this is your posterior basal. If you choose one, you go with lower apical instead of posterior basal. Now, why am I asking you to do that? The reason is that posterior basal, it is the most dependent when you talk about the erect lung. When you talk about the erect lung, in that case, posterior basal is the most dependent part when person is standing erect. But when person is standing supine, the lower apical is a more appropriate answer for the most dependent part. I hope you understand what you mean by most dependent, where you have accumulation of any fluid, where any fluid will automatically drain due to gravity, right? Or any abscess or any infection. Very important for when you talk about infections like tuberculosis, right? So that is why you should know which part is more dependent. Question number 12. Guys, don't think of this, don't calculate the time that we are taking according to time per MCQ. Think that every time we are solving an MCQ, we are learning a short concept. So by the end of the class, think of time per concept. So by the end of the class, you would have learned, if not 50, at least 30 new concepts. Okay. So think of it this way. 30 new concepts for every concept, even if you spend 10 minutes. So 5 hours should be the duration of this class. I'll try to finish it obviously in 2 to 3 hours. Okay. 300 new concepts, 300 minutes. Because just simply discussing a question, it's not sufficient. You also have to know everything that is there. You have to know the backstory of a question. ठीक है, पूरी कुंडली निकाल दिया करो question की whenever you see a question. All are inserting in the first rib except. Very good. So as you know that there are some attachments that are there on the first rib that you can make out. There are some depressions, there are some elevations, there are some impressions that are there on the first rib. So they are for the scalenus anterior and the scalenus medius, but not for the scalenus posterior. Why? Because the scalenus posterior, it does not attach to the first rib. Now, where does the scalenus posterior attach to? Can you tell me? Where does the scalenus posterior attach? Right. So the scalenus posterior, it attaches on the second rib. Okay. So you can make out here scalenus anterior, it is coming down. This is the first rib. Scalenus medius, this is here. It is also coming down. It is also attaching little behind the scalenus anterior, but it attaches on the first rib. However, scalenus posterior, it is going down and attaching on the second rib. So scalenus posterior attaches on the second rib, whereas scalenus anterior and scalenus medius, they will attach on the first rib. They will attach on the first rib. Question number 13. Structures passing through the aortic hiatus of the diaphragm are all except. Like so, Afreen and Sayantan Basu, they're right that the scalenus posterior attaches to the second rib. Very good, Sayantan. Thank you for your participation. I really appreciate it. Right, so the answer is going to be option C, sympathetic trunk. Answer is going to be option C, sympathetic trunk. Now see, aortic opening of the diaphragm. Aortic opening of the diaphragm. You have some stuff that is passing. Aorta, thoracic duct, and azygous vein. These three structures, they pass through the aortic opening. So look here, aorta, azygous vein, and thoracic duct. These three structures, they pass through the aortic opening, right? So there is no doubt about them. So even if you know what are the structures that pass through the aortic hiatus of the diaphragm, you will know that these three are definitely passing. So they are not going to be the answer. Even if you don't know where does the sympathetic trunk pass through, all right? So I'll give you some idea. Let me take you to. Hmm, not sure. Yes. Okay. Let me take you to this image, right? In this image, this is the aortic opening. You can make out that this is the aorta passing. This is the azygous vein, and this is the thoracic duct. Right? This is the thoracic duct. Now, where does the sympathetic trunk pass through? All right, it passes behind the medial arcuate ligament. It passes behind the medial arcuate ligament. Okay. So on this side, this is the medial arcuate ligament, and it is passing behind it, right? So this is the sympathetic trunk. This is the sympathetic trunk. As you can make out, neither on the right side, neither on the left side does it pass through the aortic opening. It has its own passage. It has its own passage. All right. It passes behind the medial arcuate ligament. Passes behind the medial arcuate ligament. Okay. So you know why the answer is going to be option C, sympathetic trunk. That is why I am teaching you this in detail, so that there is nothing, nowhere where you have any chance of a hernia or any site of weakness. Okay. Your knowledge should be hernia free. There should be no herniation of your knowledge contents. Okay. So these are aortic opening, esophageal cable. Okay. Aortic is at T12, T10 पे होती है esophageal, at T8 पे होती है vena cable opening. Right. Question number 14. Stable is very important to remember, guys. The levels, the names, and the structures. आइजैक न्यूटन यहाँ गिर के आया होगा एप्पल की तरह. left superior intercostal vein, it drains into the correct. Option D is the left brachiocephalic vein. Right? We have already discussed this that the left superior intercostal vein it does not drain into the azygos. So it's just a different way of asking that. It's just a different way of asking that where does the it's a more direct way of asking where does the left superior intercostal vein drain. ठीक है सीधा पूछ ही लिया उसने मुंह पे तो ये रही left superior intercostal vein and it is draining here as you can make out into the vein that is the left brachiocephalic. All right, very clear cut. Let's move on to question number 15. एक बार बाकी veins का देखना है तो देख लेना. This is T7, this is T8. So you can see this is the azygos. This is the accessory hemiazygos that is going. This is the hemiazygos that is going. Is draining the lower four posterior intercostals. The subcostal will also be there. It will join and it will actually be forming the azygos and the hemiazygos. The upper four posterior intercostals they are going here. Then three are uniting here and forming the left superior intercostal. And then there is one that is going directly. Okay, that's the internal thoracic. Question number 15. Question number 15. Fossa ovalis. What is fossa ovalis? What is the adult structure for fossa ovalis? Remember, whenever you are writing in right. So, Sayantan Basu has answered the question that fossa ovalis it closes because of the fusion of septum primum and septum secundum. That's absolutely correct. The answer is for option question number 15 is fusion of septum primum and septum secundum. Although this is actually an embryology question, go ahead, open your Langmans. That's the standard textbook that you have to read for embryology. Septum primum, septum secundum. They fuse, right? Septum primum it fuses with septum secundum, and that's how it is going to be closed. That's how it is going to be closed. So the no foramen ovale का जो हाँ ठीक है. So the remnant of foramen ovale is fossa ovalis. The embryological structure is foramen ovale. Absolutely correct, sir. Ovalis नहीं ovale. 16. Where is the SA node located? ठीक है. Where is the SA node located? If you are having your prof examinations and you are preparing for the thorax, video is going to be really helpful for you, and it is definitely going to be helpful for the NEET PG aspirants also. You are answering for question number 2. Chinese. Oh, I'll have to put my laptop on charge. पता है ये लोगों आप लोगों को आंसर? ओके, वसुधा, डू यू नो व्हाई दिस इज गोइंग टू बी देयर? व्हाट इज द आंसर्स लॉजिक? Are the Purkinje branches sub-epicardial or are they in which? You guys don't know about it, I will say. All right. So think about two things. One, SA node. Second, think about Purkinje branches. Yeah. SA node, it is located sub-epicardially, and Purkinje branches, they are located sub-endocardially. Right? They're basically located inside the heart. So this is your heart, and this is your going to be your chambers. Maybe one wall. So it is located here, the Purkinje branches. Whereas the SA node, it is almost on the surface. It is almost on the surface, less than 1 millimeter from the surface. Less than 1 millimeter from the surface. So SA node, it is subepicardial, whereas the Purkinje branches, they are subendocardial. That is one important point of difference that you have to maintain between the SA node and the Purkinje branches. Okay. Question number 17. Yes, Purkinje branches are subendocardial. Very good, Afreen Alam. Very good. So, question number 17, which of the following is true about the parietal pleura? I have taken a class on the nerve supply of the pleura, right? एक मेरा छोटा सा लेक्चर है नर्व सप्लाई ऑफ प्लूरा पे, या उसके पहले 15 मिनट स्किप करना because they are the subscription pitch. So watch the last 25 minutes and I have detailed I have explained the nerve supply of the pleura. Right. So Vasudha has answered, Chetanya has answered, and Afreen Alam has answered that the answer for 17 is B, that the parietal pleura is sensitive to pain. Alright. So here is your differentiation between parietal pleura and visceral pleura. Here we write it as d by dx. Names, there is this terminology that differentiation we write it as a differentiate d by dx. Okay. Parietal pleura, it is coming from the somatopleuric layer. Visceral pleura, it is coming from the splanchnopleuric layer. This is basic embryology. Then parietal pleura, it is supplied by somatic nerves. Visceral pleura, it is supplied by autonomic nerves. This is pain sensitive. This is pain insensitive. Although this is sensitive to distension. Alright, this is sensitive to distension. And this is the costal pleura and the peripheral diaphragmatic pleura. They are supplied by intercostal nerves. and mediastinal pleura and central diaphragmatic pleura, they're supplied by phrenic nerve. So basically intercostal nerves and phrenic nerve, they will supply the parietal pleura, whereas the vagus and T2 T5 sympathetic and the nerves accompanying bronchial vessels, they will be the ones that will be supplying the visceral pleura. So that's a differentiation. You can see the vagus, it supplies the visceral pleura instead of the parietal pleura. My mother is calling. I have to tell her I'm taking a class. Right. So do take a screenshot of this. If you haven't watched this lecture now, this is the summary slide of that lecture. So for most of my lectures, I make a summary slide. So do try to keep those screenshots together so that you can revise some things that are very quick revisions, right? So this will give you directly 5 marks in your prof examination if you are very thorough with the differences. Okay. Question number 18. Right. Anterior cardiac vein. You all are well aware of the answer. Santan, Basu, Zachaini, and Afreen. Right. So I had taken this class on coronary circulation as I've already told you. So this is an image from that class where I showed you that the anterior cardiac veins, they will open directly into the anterior wall of the right atrium. So they are the cardiac veins which are not branches of the coronary sinus. So they are not tributaries of the coronary sinus. And I told you to remember that point and see here that you have a question regarding it. Okay. There are some points which have exceptional value from a question point of view, from an MCQ or a question point of view. You have to catch those points. Okay, that's the key to studying in MBBS. Otherwise, there is so much to cover, you cannot remember everything. You have to be very thorough with all the important regions, with all the exceptions, with all the important points. Question number 19. Esophagus, it receives its blood supply from all except. Okay, so there is this standard pattern of asking questions where you've been asked all except. So you have to be very careful when you answer, because then it becomes a diagnosis of exclusion, like Bell's palsy. Remember, Bell's palsy is a diagnosis of exclusion. Randomly याद आ गया तो mention कर दिया. Okay, so you were all answering for question number 19 as D. Okay. Okay, only the Cheney has answered so far as bronchial artery. So are you thinking that the bronchial artery it supplies the lung, or the bronchioles it will not supply the esophagus? Think about which of these arteries do you know the most about? Okay, B. Inferior phrenic artery. No, both of you are wrong. Only Vasudha is right, that the answer is internal mammary artery. Okay. See, you know about the internal mammary artery. The internal mammary artery, its branches are PAMPS. We just talked about it. Pericardiophrenic, anterior intercostal. Then you have mediastinal branches, right? Or musculophrenic. This M was musculophrenic. And this P was perforating branches, and this S was superior epigastric. There are no esophageal branches here, right? You can make out there are no esophageal branches here. It does not supply the esophagus. The rest of them, they do supply the esophagus. So they supply the esophagus in different parts. So this is the inferior thyroid artery. And you can see while going upwards, it gives an esophageal branch. Okay, this is the bronchial artery. Bronchial artery, it is also giving esophageal branches. Then you have esophageal branches which are coming from the aorta, right? And you obviously have esophageal branches which are coming from the phrenic. They are coming from the phrenic. Then you have the left gastric artery. It also gives esophageal branches. But there are no esophageal branches from the internal mammary artery. There are no esophageal branches from the internal mammary artery. Yeah. Question number 20. Last question of the first 20 questions. Obviously, question number 20. Still have a long way to go. We still have 30 questions to cover. So let's increase our speed a little now. Let's increase our speed a little now. So Santan Basu has answered for this question itself. Please write which question you are answering for so that I know that if you're answering for 19 or are you answering for 20. Write 20 and your answer. Otherwise, sometimes I get confused when you delete messages or there's some confusion there. So we go one more answer here. Right, behind the left atrium. Absolutely correct, Vasudha. Vasudha has been giving consistent good answers, so let's appreciate her. So look here, this is a perfect diagram to show you exactly where the oblique sinus lies. If you've actually been to the dissection hall and if you put your hand behind the left atrium, you will be able to put your hand in the oblique sinus actually, right? So it feels you really actually understand that where does the oblique sinus lie and what is its actual area. So this is the transverse sinus, which is between the, you can make out here, it is between the aorta and it is between the pulmonary veins, right? So it is somewhere here near the great vessels. Okay. That is where the transverse sinus lies. The other sinus is the oblique sinus and it lies just behind the left atrium. Oblique sinus, it lies behind the left atrium. Okay. It is oblique sinus is basically a sinus of the pericardium. It's basically a folding of the pericardium. It's because the pericardium gets invaginated that way, right? So that is why the oblique sinus is formed. Okay. You can make out where the oblique sinus is in the heart also. Okay. Behind the left atrium. Question number 21. I don't really like this question, but it has been uh, an MCQ point in from the PG entrance perspective. It's not very important from your prof point of view, but you can still try it out. It's not very difficult to answer. It's more or less a guess between two options. If you have an approximate idea of the trachea, you have to guess between two options. right? So Santan has been able to answer correctly. It is in fact 10 to 12 centimeters. In males, it is between 10 to 13 centimeters. The average is somewhere around 11.8. Okay. It's relatively shorter in females because females have a smaller body. So the answer is 10 to 12 centimeter. You might have gotten confused with 15 centimeter. Not matter, 15 centimeter, 10, 12 centimeter, everything is the same. You should be familiar with the concepts. Data, don't try to unnecessarily memorize this. Okay. Question number 22. Hi Saini Devnath. You guys can also hit the like button for this YouTube video. If you want, I mean, if you actually like it. लाइक बटन दबाने से क्या होगा, हम थोड़ा खुश हो जाएंगे और तो कुछ नहीं होगा वैसे. हाँ, अगर लेट्स से इस वीडियो पे 500 लाइक्स आ जाते हैं तो हम पैसा डिस्ट्रीब्यूट करेंगे. ठीक है. ब्लड सप्लाई ऑफ लंग्स आर ओके. सो फर्स्ट ऑफ ऑल, as you know, lung has a dual blood supply. It also receives from the pulmonary circulation, so it receives from the pulmonary artery, and it also receives from the bronchial artery. It also receives from the bronchial artery. Okay. Besides that, obviously pulmonary vein, it is also part of the blood supply. Pulmonary vein, it is also part of the blood supply. Okay. A, B, 22 A, B, C. Okay. And the third is going to be our next answer. Next question. So slowly read it because it's a little, again, it will take time for you to understand. Please keep in mind this is a multi-answer correct. So give me more than one answer which are going to be correct. You can already make it out. It is multi-answer correct. Right. 23, a lot of you answered very correctly. Very thoughtful answering from Santan and Mishti. So, C 23rd, the answer is C and D. So about the esophageal hiatus, what is going to be true? First thing, that does it lie at the level of T12 vertebra? No, that is the aortic. That is the aortic opening. So it's not about the esophageal hiatus, right? Does it lie between the true crura of the diaphragm? No, it is false. This is false. Esophageal hiatus, as you all know, it is displaced towards the left crust. See here, look. Have I kept the image? Right. So this is the esophageal opening. So it's not between the two crusts of the diaphragm. It is towards the left side. All right. It is towards the left side. So this is false. Now thoracic duct, it passes through the aortic opening, not through the esophageal opening. So what is left is C and D. Sorry, it does not lie towards the left. It lies in the right crust of the diaphragm. It lies in the right crust of the diaphragm. Okay. And it lies in the left right crura of the diaphragm, and the vagus nerve, it passes through it. The vagus nerve, it passes through it. You can make out here that this is the anterior and this is the posterior. Okay. 22 ABC. Right. Okay. 23 CD, 22 ABC. Now moving on to 24. Moving on to question number 24. Guys, remember at the end of today's class, let's do a Thorax MCQ quiz on Unacademy, right? So that you all can download the Unacademy learning app. Let's do a. So just join the Telegram group. In fact, I would say join the discussion group. That is where I'll put the text. Join the discussion group, okay? That is where I'll put in a text for the message regarding the code and the timing. Just after the end of today's class, I'm going to do that. Twenty-four branches of the right coronary artery. You are saying the answer is C. No. Again, this is multi-correct. This is multi-correct. Okay, so choose accordingly. Okay. So somebody has written 24 BC and somebody has Masuda has written 24 CE. So basically just add B, C and E. You will get your answer. E, C and E. Okay. So B, acute marginal. Acute marginal is basically the right side. On the right side you have a marginal, you have a left marginal and you have a right marginal. So the right marginal, it is called as the acute marginal. Okay, remember that. Right marginal is called as the acute marginal. Obtuse marginal is the left marginal. Okay, so they have not given it directly, they have given it in an indirect way. Posterior interventricular artery, 90% of the times right cardiac dominance. So it comes from the right coronary artery. Diagonal artery is a branch of the left coronary artery. Okay, and the posterior ventricular artery, it also comes from the right coronary artery. So these are all true 24 B, C, E. Okay. Santhan has summarized his and Vasudha's answer. Very good. So these are all the branches. This is the course. This is the distribution. So I've repeatedly kept these diagrams so that these are from my own personal notes that I have made for all of you. I had taken this in the coronary circulation class. I had made these for those. So that you have no confusion. This is basically made from Gray's Anatomy. So it's 100% accurate. So you can refer to these even for your answers writing for your profs. Okay. Question number 25. 25, guys, waiting for your answer from your end for question number 25. 8. We have answered for 25 A terminal bronchiole. Right, Santhan and Mishti both have answered, but that's the wrong answer. The correct answer for this question is option B, respiratory bronchiole. Okay, I guess the others they are not. Even Vasudha has answered A. Generally, Vasudha is not wrong, but I'm little okay with this fact because this is a relatively tough question and it's a relatively typical question, typical NEET PG question. You have to be very specific to know this. So, okay, it's okay. 25, the answer is option B, respiratory bronchiole. Okay. Question 26. The commonest variation in the arteries arising from the arch of aorta. Again, this is a question from Grace. You have to be. Again, I am not expecting that you guys would have read this. It's a difficult question. Okay, so you answered C. Very good. 26, the answer is C. Okay, so for this, I will give you some reference if you guys want to read this, and if you are curious about it, I will give you a reference. I'll put a reference in the chat box if you are interested to read what are the various variations. And that is, I am kind of introducing a little bit journal reading to you because I don't want to make you guys reliant on facts. I want to make you guys reliant on searching information in a proper, authentic way, right? So it's a very good way to gather information, journal reading, or to collect scientific articles, or to read, basically to read from papers. Okay, I will not expect you to be reading a journal because I don't do that myself. Basically, to be able to read stuff from papers. Okay, because they are very summarized informations. They're the most authentic. They're the most researched things that are there, and they're a good summary of everything. Okay, because some person focused on a very particular small topic, so it is a very good, detailed, and very perfectly written thing about something. Okay, so try to learn reading stuff from papers. Okay, okay, I sent the source. Right, great. So the answer is left common carotid artery arising from the brachiocephalic trunk. Although the research paper found that in most of the cases, over 70 to 80% of the cases, the typical arrangement where you have the arch of aorta, you have the brachiocephalic trunk, right common carotid and left right subclavian coming from it, and the left common carotid comes separately, left subclavian comes separately. But there was in around, I think the study was for 800 individuals. In around 100 individuals, what was found was there is a right brachiocephalic trunk and there is a left brachiocephalic trunk, and most में there was this partition. Okay, so that might become important in future. Let's say you become a cardiothoracic surgeon, and you have to know that there is some variation in the arteries arising from the arch of aorta, right? You might think कि यार ये मैं क्यों याद करूँ, ठीक है? But the thing is that that's how medicine is. You cannot say that यार मैंने तो यही वाला वेरिएशन पढ़ा है आयोटा का, किसी के आयोटा डिफरेंट है तो डिफरेंट है. यू विल हैव टू अकोमोडेट दैट डिफरेंस, यू विल हैव टू अकोमोडेट ऑल द स्ट्रक्चरल changes due to that. Okay, question number 27. The lumbar region of the vertebral column permits all of the following movements except. तो मैंने ये जर्नल आर्टिकल भेज दिया है सोर्स, अगर तुम्हें you would like to see how you can understand this, that basically has given you all the possible. गाइस क्वेश्चन नंबर 27 बहुत इजी क्वेश्चन है, कंफ्यूज मत हो क्वेश्चन पढ़ के, बहुत इजी क्वेश्चन है, 2 मिनट में बता दोगे. Guys, if anybody of you is planning to take a plus subscription, please do let me know my referral code that you can use for a plus subscription. And then Vasu has given the answer as D, rotation. Okay, so yes, think about it. Lumbar region of the vertebral column. What happens? So if you try to flex, what is flexion? Flexion and extension will basically be, this will be flexion, this will be extension. That is allowed in the lumbar region. You can also bend, but your lumbar region, it will not allow rotation. For rotation, you have to use your upper back, but you cannot rotate with your lower back. Okay. So lumbar region of the vertebral column, if you try to rotate it, there will be restriction. You will feel this clutch sound, but you will not be able to rotate using your lower back. Okay. That is not allowed for the lumbar region of the vertebral column. You'll basically be moving your hip here You won't be able to move your lumbar region of the vertebral column in sense of rotation. Okay. क्वेश्चन नंबर 28. इस पे भी मैंने बहुत स्ट्रेस दिया था अपने कोरोनरी सर्कुलेशन के लेक्चर में. I know this class might have gotten a little tiring for you by now. Right. So you've gone with answer B for middle cardiac vein. That's correct. Middle cardiac vein, it is located at the posterior interventricular surface. So do you know it runs along with which artery? You obviously know it runs along with posterior interventricular artery. That's correct. So look at this. This is a view from behind. This is a view from the view of the behind, right? This coronary sinus, everything that is dotted, that is from behind. And there's only the great cardiac vein that runs anteriorly and some part of the small cardiac vein. But mainly the coronary sinus and everything related to the venous supply is present posteriorly. Okay, so just look at all those dotted lines. So my stress area is going to be that. So you have to see this is the coronary sinus. From the right side small cardiac vein comes, from the left side great cardiac vein comes, ठीक है, and बीच में क्या रह गई middle cardiac vein which comes posteriorly, right? So middle cardiac vein, remember, it is present posteriorly and it runs along with the posterior interventricular artery. It runs along with the posterior interventricular artery. So that's how I remember which is which. See, it's a very simple way of remembering. Just try to grab this and you will be able to understand. So how to do this? This is your heart that I have made. Okay, now just let's assume I have made it from a posterior view only. Let's assume I have made it from a posterior view only. Okay. So if here is your coronary sinus, here is your coronary sinus. So there are three things that have to come to the coronary sinus. There are three things that have to come to the coronary sinus. Okay, I can't take this to your posterior view because फिर तुम्हारा right left change हो जाएगा. ठीक है, तुम्हारा right left change हो जाएगा. तो अभी इसी को right रखो, इसी को left रखो, dotted बनाऊंगा. ठीक है. तो ये जो dotted इधर गया right side से और इधर से गया लेफ्ट साइड से. ठीक है, तुम्हारे हार्ट का ज्यादा मेन क्या है? व्हाट इज मोर मेजर इन योर हार्ट, द राइट साइड और द लेफ्ट साइड? द लेफ्ट साइड इज ऑब्वियसली मोर मेजर बिकॉज द लेफ्ट वेंट्रिकल पम्प्स टू द बॉडी. तो बस दिस इज अ वे टू रिमेंबर. लेफ्ट साइड इज ग्रेट, लेफ्ट साइड इज ग्रेट, सो लेफ्ट साइड इज ग्रेट कार्डियक वेन, राइट साइड इज स्मॉल कार्डियक वेन, एंड उसके बीच में जो पड़ेगी वो तो ऑब्वियसली मिडिल कार्डियक वेन है. तो समटाइम्स यू माइट गेट कंफ्यूज, ग्रेट कार्डियक वेन कहाँ थी और स्मॉल कार्डियक वेन कहाँ थी. तो ये वो है. और यहाँ पे एंटीरियर सर्फेस पे होती है एंटीरियर कार्डियक वेन जो ड्रेन करती है डायरेक्टली इनटू द राइट एट्रियम. ओके, so this is regarding the cardiac veins. ठीक है, so I had explained the entire course. यार, do watch the lecture on coronary circulation. That will clear a lot of your concepts. Okay, so that's about question number 28. The answer is B as given by Sayantan and Vasudha. Okay. Question number 29. Long question. Read it slowly, slowly. Right. So 29, you are saying phrenic nerve. You're saying phrenic nerve. No, that's wrong. Think of this. In angina pectoris, the pain radiating down the left arm, it is mediated by increased activity in afferent sensory fibers contained in the. Okay, so see, the answer is not B, phrenic nerve. The answer for this is thoracic to splanchnic nerve. So basically, angina pectoris. Now, why would it radiate to the left arm, down the left arm? So as you can make out, that would basically be because, not because of the phrenic nerve, because the phrenic nerve it does not supply down the left arm. All right, phrenic nerve maximum it supplies the tip of the shoulder. Okay, because that's till where the phrenic nerve territory is. But the thoracic splanchnic nerves, they're basically sympathetic nerves. So the pain of angina, it is radiating down the left arm because there is increased activity in the thoracic splanchnic nerve because they are the ones which are carrying the main fibers which are there for your uh, angina pectoris, right? So this will be through the sympathetic system. So the thoracic splanchnic nerves will be responsible for this particular phenomenon. Question number 30. Autonomic supply to the SA node is what kind of supply? Very easy question. Very, very, very easy. Autonomic supply to the SA node, it is definitely, you're right, it is sympathetic excitatory. Parasympathetic, it is inhibitory. Parasympathetic is going to be inhibitory, right? To the vagal fibers, it is having inhibitory supply. As you know, that SA node is going to be suppressed by the vagal. Sympathetic supply is going to be excitatory. Okay. Question number 31. That's right. All of these contribute to the stability of vertebral column. I don't think I need to explain this. Right? Interspinous ligaments, they will also provide stability. The paraspinal muscles, all the muscles that are present around the spine, they are going to contribute to the stability. And the intervertebral discs, they are also responsible for stability. No doubt, vertebra, intervertebral discs, everything here, it is contributing to the stability of the vertebral column. Question number 32, it is a slightly important. You guys go ahead and answer it. Meanwhile, allow me to drink a little water. This bottle is finished. Okay, so I don't have any question answers for 32 so far. Please do answer for question number 32 also. So as you guys all know, tomorrow also I'm going to have a session for thorax MCQs only. Tomorrow also we'll have similar kind of a session. That is my yeah. So the answer that has been given by Sayantan and okay, Sayantan has given the answer for 32. Vasudha hasn't answered. The esophagus, where is it the narrowest? So can you apply some logic to that? What does the esophagus carry? The esophagus, it carries food. The esophagus, it carries food. So ideally, where should it be the narrowest? Where should it be the narrowest? It should be the narrowest at a point, right? In fact, that is kind of one of the narrowest parts of your entire GIT. Because let's say it is narrowest somewhere in the middle. Let's say it is narrowest somewhere in the middle. What will happen is that the foodstuff would have passed at the beginning, but it will get stuck in the middle, right? Now that will be problematic. But if something is very broad, it should get stuck at the beginning of the esophagus, right? It should get stuck at the beginning of the esophagus so that you know that it is too broad to go into your GIT. So where should the esophagus be narrow? Should it be narrow near its termination so that food can get stuck at the esophagus at the upper border of your stomach, or should it be narrow at the beginning where you can simply cough it out, right? So it should be narrowest at the beginning where you can easily throw it out. So the answer for 32 is going to be option D. Besides that, you should also note that there are esophageal constrictions. Esophagus normally has three constrictions. First at the pharyngo-esophageal junction. Second is at the thoracic region where you have the ioto-bronchial constriction. And the third is the diaphragmatic constriction where you have the diaphragm, which is near the termination. So this is the constriction near the beginning. And it is 6 inches from the incisor teeth. It is 6 inches from the incisor teeth. So that is also asked that what are the various places where you have the esophageal constriction. So esophageal constrictions is an important question for your prof examinations. And so this one is set at 6 inches or 15 centimeters, which is essentially the same thing. And it is the narrowest portion of the esophagus. It is approximately at the level of C6 because that is where the esophagus starts. After 6 inches, you have 6 inches, 11 inches, and sorry, 6 inches, 9 inches, and you have it at 15 inches, 6, 9, 15, as far as I remember. Although I want to check first. Also, now can you think of why these probably they are more relevant? Because these are the places where something can get stuck or where you can have some abnormality in the esophagus. That is why these constrictions are relatively important. There are also constrictions of the ureter. If you guys remember, the ureter also has some constrictions. So the constrictions are important to remember because those are places where something can get stuck. Those are places where something can get stuck. Okay. Right. So like I said, there are three constrictions. Cervical constriction is the starting one. It is at the level of C5, E6. Then next you have the thoracic constriction. Thoracic constriction is at the level of your sternal angle T4, T5. Okay. And then abdominal constriction is at your esophageal hiatus, that is at the level of T10 or approximately T10, T11. Yeah. So that is about this constrictions. I just want to check the inches a little for you. Okay. So see, this is at 6 inches. This is at 9 inches and this is at 10 inches. Okay. So at 9 inches you have the aorta and at 11 inches you have the left principal junction. ठीक है, तो ये 9 to 11 inches लगा लो kind of, and वो लगा लो तुम 15 inches. So this is what you have to remember: 6, 9, 11 and 15. This is everything that you have to remember. So this is from the upper incisor teeth. This is from the upper central incisors. 33. So this is a very simple question. We've already discussed this before. I'll be sending the PDF also on my Telegram channel, so you can join my Telegram channel for that purpose also. Thirty-three is very simple, guys. Guys, 33, left superior intercostal vein drains into. We've already done this. The answer is going to be left brachiocephalic vein, right? Answer is going to be left brachiocephalic vein. It was the same as Eiger's diagram. Why have you got confused here? Anybody wants to take an answer here? So, Sayantan, Vasudha, are you guys there? Or are you guys answering this? Question number 34. Let's see if you guys are able to answer this. Arch of aorta lies in which mediastinum? Arch of aorta lies in which mediastinum? Okay, so very clear, anterior mediastinum, posterior mediastinum, anterior divided into superior, middle, and guys, answer for question 34. Okay, so we have someone new. Chandrakala Shnon. Alright. So Chandrakala Shnon is saying that the answer is for 34 is D. That's absolutely correct. The arch of aorta, it lies in the superior mediastinum. In fact, all the great vessels of the neck, the great vessels, they do lie in the superior mediastinum. Superior mediastinum extends from the manubriosternal junction to the T4, to the T4. So we had a question regarding the arch of azygos. Why does it not lie in the mediastinum, superior mediastinum? Because it already drains into the superior vena cava. But the superior vena cava does lie in the superior mediastinum, right? So you can make this out here. The left and the right brachiocephalic veins, they will be right lying here. SVC will lie here. Arch of aorta, it will lie in the superior mediastinum. The left subclavian, left common carotid, brachiocephalic trunk with the respective divisions, right subclavian and right common carotid. All of this will lie in the superior mediastinum. Okay. So question number 35. Base of the heart is formed by. Base of the heart is being formed by. Easy question 35, guys. Base of the heart. So you should know what is the base of the heart, what is the apex of the heart, what is the inferior surface of the heart, what is the ventral surface of the heart, what are the surfaces of the heart, what are the boundaries. Right, so Anjali has given an answer to us 35 as B. Alright, so now I can understand why if the four or five of you are getting confused is because this is a multi-answer correct. I was expecting that you will see the question and you will realize that it is multi-answer correct because it's relatively very simple. You should know that the base of the heart it is formed by what? You know that there is a base of the heart, there's a diaphragmatic surface of the heart, there is a anterior surface of the heart, there's a pulmonary surface of the heart, right? So no, it's not B and D. So B is there, that B is correct. There is one more option that has to be included. So the correct answer for 35 is option A and B together, right? It is 35, A and B. Now why is that? See, the base of the heart is this region. This is the base of the heart. And you can make out this is going to be the right atrium and this is going to be the left atrium. So the base of the heart, it is made up of both the right and the left atria. Base of the heart, it is made up of right atria plus left atria. Let's go to question number 36. Let's go to question number 36. Which of the following is correct regarding the SA node, right? So that was our question. Which of the following is correct regarding the SA node? So it is supplied by the left coronary artery mainly. No, that's false. It is supplied mainly by the right coronary artery. In 65% of the cases, it is supplied by the right coronary artery. Only in 35% of the cases, it is supplied by the left coronary artery. There's a nodal branch that comes, right? So A is not correct. It is not situated in the left atrium. It is situated in the right atrium. It is not a part of the walls. It generates an impulse at the rate of 70, approximately 70 per minute. Yes, 70 to 72 beats per minute. And it is responsible for initiation of the heartbeat. It is the fastest. It is generating impulses at the fastest rate among all the nodal tissue. So that is why it is the pacemaker of the heart. It is the pacemaker of the heart. Question number 37. Your turn to answer question number 37. Guys, answer to question number 37. Do you guys have an answer to question 37? So viewers, you can skip through this part, right? Because right now, I guess the people who were answering so far, they've logged out for some reason. So I'll wait for another minute and then I'll rush through the questions because otherwise there's no point in waiting if there's no one to answer. It's probably because it's gotten a little late also, and it's also maybe because the lecture has gotten a little long, which is something I also realized. So let's go to question number 37, or maybe people are afraid of statement-based questions. I would have also gotten. So somebody else just joined us. So can anybody answer this? Let's read along with me. All of the following are true regarding the heart except, right? Regarding the heart except. So which of the following? So the question is basically asking what is false about the heart. The coronary sinus, it opens into the right atrium on the posterior surface. Yes, this is true. SA node, it is supplied by the right coronary artery. Yes, this is true. 65% of the cases, this is the main thing that happens. Left auricle, it projects anteriorly to overlap the infundibulum of the right ventricle. Again, that's also true. Left auricle, there's this flap and it covers the infundibulum of the ventricle, right? Of the right ventricle. That's completely true. But vena cordis minime, right? So these are basically veins that are present all over the heart, also called as Thesbasian veins. They drain directly into the chambers of the heart, not onto the surface of the heart. They drain directly into the chambers of the heart. So that is what was missing here. They drain directly into the chambers of the heart. That should have been specified. That is going to be the correct answer to this question. Question number 37. Question number 38. Occlusion of the LAD will lead to infarction of which area? Occlusion of LAD will lead to infarction of which area? LAD occlusion. What is LAD? Please, I hope you understand what is LAD. Guys, can we get a quick answer? At least take a guess, even if you don't know it. Try to take a guess so that we can go through the questions really quick. I don't want to spoil anyone's fun of answering the questions also. And I also want to go fast. So like Chandrikala is at question number 36. So it would be better if you guys join me towards the live end of the class. You skip through the pauses and you come to the questions that are going on now live. Okay, you can watch the previous questions later because I can see that two or three people they're still watching, but they're probably watching some previous part. So Varisha Khan has answered that the answer is B, anterior wall of the left ventricle. That's absolutely correct. LAD basically refers to left anterior descending artery. It is the most common site of thrombus, right? Most common artery that is infarcted. Left anterior descending artery, also called as widow's artery. Why? Because husband will have heart attack, woman will become widow. So this is called as widow's artery. So you can look here. This is kind of a typical diagram that is drawn. So this is the left anterior descending artery that is coming here. This is the obtuse marginal. This is the right marginal artery, and this is the basically the right coronary artery. Here you will have the right marginal artery. So when left anterior descending artery is there, the area that will be infarcted will be the anterior wall of the ventricle, right? So the anterior wall of the left ventricle will be the one that will be infarcted when you will have this issue, right? So question number 39, which of the following do not elevate the ribs? Which of the following muscle will not elevate the ribs? Question number 39. परीक्षा खान इसका आंसर भी दे दो तो कन्या has answered for this B, serratus posterior inferior. That's absolutely true. ठीक है, तो एक क्वेश्चन होता है थॉरेक्स में mechanism of breathing. ठीक है, this is very important for your physiology also and it's very important anatomical question also. ठीक है, ये भी मैं बोलना भूल गया बट थॉरेक्स का ये important question है. ठीक है, एंड ये पढ़ना होता है स्नेल्स एनाटमी से. ठीक है, स्नेल्स क्लिनिकल एनाटमी आती है एक बुक, दो आती है, बाय सिस्टम्स आती है और बाय रीजन आती है. तो स्नेल्स क्लिनिकल एनाटमी बाय रीजन. ओके, नाइन्थ एडिशन में दिया हुआ है ये, तो नाइन्थ एडिशन याद है लेटेस्ट, तो शायद 10th भी आ गया हो, आई एम नॉट श्योर. बट mechanism of breathing, it's very good if you read it from there everything is mentioned. Serratus posterior superior, one of the main muscles which is responsible for elevating the ribs. ठीक है, levator costorum accessory way में external intercostal भी elevate करती है ribs को, and it is again intercostals are the main muscles involved in inspiration is the active process. Serratus posterior inferior, it cannot elevate the ribs because उसकी orientation देखो. Look here, this is the serratus posterior inferior, this is the serratus posterior inferior. So it is located in this way. Now, if it moves, can it elevate the ribs? How can it elevate the ribs? It is attached to the 9th, 10th, 11th, 12th ribs. ठीक है, so it is not going to elevate the ribs. तो elevation of rib serratus posterior superior कर सकता है, serratus posterior inferior नहीं कर सकता, right? And then आपको पता ही है, so you know about serratus anterior. So this is the muscle of the back, serratus posterior superior, serratus posterior inferior. You don't usually pay much attention to the back when you are studying gross anatomy, but since we are doing mechanism of breathing here, we do talk about these muscles, serratus posterior superior and serratus posterior inferior. So Sukanya has answered B, Varisha Khan has answered A, but serratus posterior superior is one of the muscles that does elevate the ribs. Okay. Question number 40. Superior intercostal artery is a branch of. I guess मैं आपके सामने बहुत ज्यादा पानी पी गया हूँ. जोश जोश में मैंने अभी 1 लीटर पानी खत्म कर दिया है. So Kanya has answered for this as C, cervical trunk, right? Superior intercostal artery. But okay, but I will tell you that that is not the correct answer. Now I'll give you a hint. I'll give you a hint. First, tell me that what are the branches of the first part of subclavian artery? What are the branches of the second part of subclavian artery? And what are the branches of the third part of subclavian artery? Okay, first tell me this very basic thing. Sir, just tell me the branches of the second part of subclavian artery. Guys, I can see 5 or 6 of you are watching. मेरे को second part of subclavian artery की branch बता दो, इसमें से कौन सी है? One of these is a branch of the second part of subclavian artery. बाकी लोग लाइक बटन दबाए या ठीक है. सी सेकेंड पार्ट ऑफ सबक्लेवियन आर्टरी की ब्रांच इसमें से है कॉस्टोसर्वाइकल ट्रंक, राइट. The costocervical trunk, it gives the superior intercostal artery and it gives a deep cervical artery. See, costocervical means, costo means it will give some intercostal branch or it will give some branch to the ribs, and cervical means it will give some branch to the neck. That's very obvious. Costocervical trunk से ही clear हो जाता है. So that is how you have to go about this. ठीक है. Look here. This was your subclavian artery. Subclavian artery के second part से आई कॉस्टोसर्वाइकल ट्रंक, कॉस्टोसर्वाइकल से आई सुपीरियर इंटरकॉस्टल. ठीक है. तो दैट इज अबाउट दिस. बरीशा खान लाफ इमोजी दे रही है. क्वेश्चन नंबर 41. एंटीरियर इंटरकॉस्टल आर्टरी इज अ ब्रांच ऑफ. देखो मैंने एक निमोनिक बताया था इंटरनल मेमोरी आर्टरी के लिए, राइट. इंटरनल मेमोरी आर्टरी या फिर इंटरनल मेमोरी और इंटरनल थोरैसिक सेम बात है, राइट. This is one and the same thing. The mnemonic that I told you for this was PAMPS. In that what was A? A was anterior intercostal. A was anterior intercostal artery. Anterior intercostal artery, it is a branch of internal thoracic artery or the mammary artery. So please remember 41, the answer is going to be option A, anterior intercostal artery, the branch of internal mammary artery. Question number 42. All of the following structures, they pass through the superior aperture of the thorax except. Sam is saying that the answer is A. Very good, Sam. Yes, absolutely correct. The right what happens is that the recurrent laryngeal nerve, what it does is it winds around. ठीक है. तो क्या होता है? Right recurrent laryngeal nerve होती है. बेसिकली क्या होता है? ये होती है तुम्हारी सबक्लेवियन राइट सबक्लेवियन आर्टरी. ये होती है तुम्हारी राइट. ये आर्च ऑफ आयोटा बना, राइट साइड में बनी ब्रेकियोसेफेलिक ट्रंक, इससे बनी कॉमन कैरोटिड और सबक्लेवियन आर्टरी. बेसिकली ये जो राइट सबक्लेवियन आर्टरी होती है, that is the site where your recurrent laryngeal nerve, it will wind around it. Okay, it winds around it. So because it winds around it, it does not go through the superior aperture of the thorax. Instead, it stays in the neck. So the answer is option A, right recurrent laryngeal nerve. For 42, the answer is going to be option A. 43, there is some clinical anatomy point here. There is a very important clinical anatomy point here. So Chandrakala is lagging. I guess Chandrakala is at question number 40 right now. We are at 43. Right. 43, the answer is upper border of the rib. So it's a very good question that thoracocentesis, first of all, you insert a very large needle inside the link, inside the thorax. So, right, what you do here is, so this is going to be your rib. This is the upper border of the rib, and this is the lower border of rib. So basically, your needle, it passes when your needle passes, it should go through the near the upper border of the rib, because in the lower border you have VAN arrangement, that is vein artery nerve. So you have to be very careful. This is the neurovascular plane, right? This is the where you have the neurovascular plane. So you have to avoid injuring this. You have to avoid injuring this here, right? So that is why you pass the needle closer to the upper border of the rib rather than the lower border of the rib. Question number 44. All of the following arteries are common sites of occlusion by a thrombus except. All of the following arteries are common sites of occlusion by a thrombus except. Right. Marginal is the correct answer. The most common is posterior interventricular. The most common is anterior interventricular first number पे. फिर उसके बाद आती है तुम्हारी circumflex, फिर posterior interventricular. Okay. So order is A, C, B, and D. Marginal is barely affected. Marginal is barely affected. मतलब बहुत ज़्यादा. It's not a very common site of occlusion by a thrombus, right? Priya Arora? Okay. Question number 45. The following statements are true regarding the SA node. The following statements are true regarding the SA node. It is localized at the except, right? So this question says except. The following statements are true regarding the SA node except. So this except will not be visible to you. I have written it here because probably my image would be coming in this upper right hand corner. That is why I have written except specifically for you. The following statements are true regarding the SA node except. So you have to tell me the false statement. Tell me the false statement. right? It is localized at the right border of the ascending aorta. This is false. It is localized at the right border of the superior vena cava. It is not near the ascending aorta. It is near the superior vena cava. It contains specialized nodal cardiac muscle. That's true. It is supplied by atrial branches of the right coronary artery 65% of the times. This is true. 35% of the population, there is the left coronary artery. And it initiates the cardiac conduction. It is the pacemaker of the heart. That is absolutely, absolutely true. Okay. So right, Chandrakala has also caught up. So the answer is A. Let's move to question number 46. While you're answering question 46, I'll just quickly go to the washroom. As I already told you, I had 1 liter of water. People, we have Aisha Sheikh also with us. Question number 46. Fairly simple. The venae caudae minime, I have already told you, venae caudae minime, they do not drain into the coronary sinus. They will directly drain into all four chambers of the heart. They will directly drain into all four chambers of the heart, right? So you know that this is not the answer. C is not the answer. Okay. And it lies in the anterior part of the coronary sulcus. You know it lies posteriorly. It lies posteriorly. So this is not the answer. It ends in the right atrium. Yes, this is absolutely true. It does end in the right atrium. उसके बाद कुछ सोचना ही नहीं. Yes, the answer is that it does end in the right atrium. Question number 47. Which of the following structures constitute part of the ventricle of the heart? Which of the following is part of the ventricle of the heart? Okay. So Kirti has said, hello Chetanya sir. Okay. First of all, telling his Chetanya, कोई बात नहीं. Wanted you to know that your classes are really helpful. Even though I missed the live class, I watch it later on. Thank you so much for that compliment, Kirti. It means so much to me. And even if you missed the live class, I would really love it if you could drop such a comment on a class that is something that you watch in a recorded way. And I would say that when you watch it in a recorded way, try to skip through the pauses, okay? And I'm sure you already do that, but it's just a tip that skip through pauses, because obviously in a live class you have to give some pauses, and try to watch it on 1.75x. But if I speak too fast, you can watch it on 1.5x. That should be enough. And that's about it. And there are a few classes that I've made in a recorded session. So those classes are really good. Like I've made one on inguinal canal. It is premiering tomorrow. Really excited for it. It's a good class, and inguinal canal, when I studied myself, I found it to be a really difficult topic. So I thought that why not simplify it, why not put it into the form of notes and quick points so that you can easily revise it. Yeah, thank you so much. So the answer for question number 47, if you guys can't make out, it is trabeculae carne. Trabeculae carne, it is a feature that is seen in the ventricles. So look here, these are the ventricles. So this rough part that you see, so trabeculae carne. Carne means cut like flesh, something like that. It's kind of basically means rough. Okay. Carne or kind of like very rough texture, somewhat like flesh. So trabeculae carne is that. So if you've heard of there used to be an adipose layer called as carne adiposa. So cutty fatty si layer, kind of something like that, right? So that's what carne means. So trabeculae carne, they have this specific typical appearance. That is what carne is actually means. It refers to that appearance, and they are seen in the right and the left ventricles. Okay, they are seen in the right and the left ventricles. Question number 48. Tejaswini talks. Right. So you have 47. Tejaswini has given the right answer. Guys, one sincere request. Can you hit the like button on this video? And I said अगर 500 likes पहुंच जाते हैं ना, तो नेक्स्ट में हम प्रॉपर क्विज करेंगे और वो 500 रुपीज का उसमें कैश प्राइज रख देंगे. When we reach 500 likes, I am hoping that soon our videos will start to reach a good number of likes. जो एक शुरू में वीडियो बनाई थी वो काफी अच्छी परफॉर्म कर रही है, जो हेड एंड नेक पार्ट 1 की थी. Right, so the answer is C, given above are correct. Vena cable opening, it is situated at T8. Esophageal opening, it is at T10. And then aortic opening is at T12. Vagus nerve, it supplies the heart. Yes, it is the parasympathetic nervous system supply of the heart. Inferior vena cava drains into the right atrium, very easy. Thoracic duct drains the right side of the body only. No, it drains the left side also. So in fact, it mainly drains the left side only. If I have to choose between left and right, it should be the left side. So answer is option C. 1 and 3 are correct statements. 2 and 4 are incorrect statements. Question number 49. The normal narrowing in the middle of the esophagus is caused by the normal narrowing. Normal narrowing means anatomical constriction. Means anatomical constriction. Right, so the answer is option D, left main bronchus. Right, so as you know, the upper constriction, it is the pharyngeal region. So the lowermost constriction, this is the cervical constriction, and then you have the middle constriction, right? So just I'll show you this. So this is the aortobronchial constriction, right? So it is due to the arch of aorta and due to the left bronchus, right? It is due to the left main bronchus. So because of those two structures here, you have the constriction, and because of that, there is the constriction here. So that you had this in the option. Arch of aorta was not in the option. Otherwise, that could have also been a correct answer in the for the middle of the esophagus. Lower is due to diaphragm. Lower is due to diaphragm. Lower is due to the diaphragm. Yeah. Question 50. Last tributary of the azygous vein. Last tributary of the azygous vein. The last tributary of the azygous vein. And surprisingly, this is also the last question. The last question of today's quiz. So I'll quickly end this quiz for you and I'll leave you to explore this question. The answer is right bronchial vein. The answer is right bronchial vein. Explore the answer. If you have any doubts, we can discuss this tomorrow, because tomorrow again we are going to meet at what time? Tomorrow we are again going to meet at the same time, that is 9 p.m. and we are going to do thorax part 2, where we are going to cover questions, the remaining questions from 50 to 100, right? So we are doing 50 every day. Tomorrow also let's do question number 50 to question number 100. So today's class, I guess you have learned around 30 new concepts. Tomorrow's class will obviously be quicker now that you are very familiar with the basic concepts of the thorax. So since today was our first class where we have discussed the thorax actually. And if you guys have any specific demands for any videos that are there for your prof examinations that you want to talk to me about, right, you can join our discussion group at the rate NEET PG Chetanya. Somebody said that inguinal canal ki video banani hai. I made that for them, right? Do hit the like button there for this video, and so that's the benefit. Take advantage of the fact that you can ask me to make whatever video you want. You have the option of being in touch with me, right? Do subscribe to the channel Let's Crack NEET PG and hit the bell icon so that you keep getting notifications about what is going on the channel whenever I'm live also. Okay, and subscribe to my Telegram channel, that is at the rate NEET PG Chetanya. That is my Telegram channel at the rate NEET PG Chetanya. Okay, to subscribe to it, and try to drop a comment once the video has stopped streaming. Okay, thank you so much. My plus referral code is Chetanya10. Okay, if you are taking a plus subscription, if your brother is taking a plus subscription, someone in your family is taking a plus subscription, this is the referral code to use, and you know why. You will get a 10% off straight away. You will get the benefit of credits. All right, so that is a great benefit that you get, and I have already told you about the iconic pricing. It is very attractive, especially if you are able to buy it in bulk, and you have the option of paying in EMI, low cost EMI. You can contact me on Instagram personally if you have any doubts. At the rate Chetanya.blue is my Instagram ID. Okay, so that is about today's class. I guess one video on perineum. Array, I have already made a session on perineum. Go ahead, see my session. I have already made a session on perineum. बहुत अच्छा session है perineum का तो. Anatomy basics करके playlist है channel पे. Let's crack NEET PG पे. I have made a session on perineum and उसमें I have covered it from your prof perspective. So and I've also covered it from your Let's crack NEET PG perspective. तो perineum का session तो देख लो जाके. Perineum is already made. Yeah. So don't worry, perineum is made. Perineum में ना main important contents of superficial और deep perineal pouches देख लेना. PDC का एक पेज है, वो अच्छे से देख लेना, ठीक है? और कोई डाउट्स? और कोई डाउट्स नहीं है तो वी कैन एंड दिस. ठीक है सैम? ठीक है सैम? Okay, guys. Bye bye. Take care. I'll be ending the stream now. If you have any doubts, you can let me know. Huh? Okay, Chandrakala, welcome.